Hello to my friends at the Cannabis Community Care and Research Network. I'm sure sorry that I can't be with you in person today, but I wanted to send you a message as you begin a conversation about one of the biggest challenges facing our Commonwealth: how to make sure veterans struggling with addiction and mental health issues get the treatment they need. I believe medical cannabis is an important part of that conversation, and that's one of the many reasons I support the full legalization of marijuana at the federal level. Now, Senator Cory Gardner and I recently took a step toward that goal by introducing our STATES Act. This is our bipartisan bill to get the power to regulate cannabis out of the hands of the federal government and into the hands of the states. This legislation is plain old common sense. It would help state regulatory systems and cannabis businesses operate without the threat of DOJ interference, and it would allow legitimate businesses to access the banking system. I also support efforts to reschedule marijuana and expunge the criminal records of people who were convicted for minor marijuana crimes. That's why I've co-sponsored legislation like the Marijuana Justice Act, which would create a fund to invest in communities that have been hurt by decades of discriminatory policing. But that's not all. We need to make sure our veterans are able to consult with their VA doctors and nurses about medical cannabis use. We should also invest in research to help us learn more about the therapeutic benefits of cannabis when it's used to treat chronic pain and post-traumatic stress disorder. All three of my big brothers served in the military, so I know the sacrifices that service members make to keep us safe. Veterans have done their part. So now it's time for us to do our part. We're standing shoulder to shoulder to honor veterans' sacrifices and help them get the treatment they need. Thank you for the chance to send this message today, and thank you for being part of this.